Alright, let's dive into the topic of pneumonia and explore its various causes. Pneumonia is a lung infection that can be caused by different types of organisms, including bacteria, viruses, and fungi. When these organisms enter the lungs, they can cause inflammation and infection in the air sacs, or alveoli, leading to difficulty in breathing and other symptoms. So, first let's talk about bacteria. This is the most common type of pneumonia, and it is typically caused by the bacteria Streptococcus pneumoniae.
Bacteria.
Other bacteria, such as Haemophilus influenza and Staphylococcus aureus, can also lead to pneumonia. Next up, we have viral pneumonia. This type of pneumonia is often caused by respiratory viruses, like the influenza virus, like the flu, respiratory syncytial virus, and more recently, the novel coronavirus. Viral pneumonia tends to be milder than bacterial pneumonia, but it can still be dangerous, especially for certain high-risk individuals. Fungal pneumonia is less common and usually affects people with weakened immune systems, or those who have inhaled large amounts of fungal spores, often found in soil or bird droppings. Some of the fungi responsible for this type of pneumonia include Histoplasma, Coccidioides, and Cryptococcus.
Now that we've covered the different types of infections that can lead to pneumonia, let's talk about some risk factors. First,
some individuals are more prone to developing pneumonia due to certain factors, such as smoking. Smoking damages the lungs and weakens their ability to fight off infections, making smokers more susceptible to pneumonia. Weakened immune systems. People with compromised immune systems, such as those with HIV/AIDS, cancer, or those taking immunosuppressive medications, are at a higher risk of developing pneumonia. Exposure to environmental contaminants. Breathing in harmful chemicals or pollutants can irritate and damage the lungs, increasing the risk of pneumonia. This can include exposure to asbestos, mold, or certain industrial chemicals. Understanding these causes and risk factors is crucial to prevent and manage pneumonia effectively. In the next section, we'll discuss the signs and symptoms of pneumonia and why it's important to seek early medical attention for proper diagnosis. Moving on to the signs and symptoms of pneumonia, it's crucial to recognize them early on to ensure proper diagnosis and treatment. Pneumonia can present with a variety of symptoms, some of which may seem like a common cold or flu at first. However, these symptoms can become more severe over time. The common signs and symptoms of pneumonia include cough. A persistent cough is often one of the first symptoms of pneumonia. It can be dry or produce mucus, which may be green, yellow, or even bloody. Fever. A high fever, often accompanied by chills and sweating, is another common symptom of pneumonia. Shortness of breath. As the infection progresses, it may become increasingly difficult to breathe, even while resting or performing simple tasks. Chest pain. Pneumonia can cause chest pain, especially when coughing or taking deep breaths. Fatigue. Feeling weak and tired is common with pneumonia, as the body is working hard to fight off the infection. Other symptoms may include nausea, vomiting, loss of appetite, and confusion, particularly in older adults. It's important to note that the severity and combination of symptoms can vary depending on the individual and the cause of pneumonia. Now, let's talk about the importance of seeking early medical attention for proper diagnosis. If you or someone you know is experiencing any of the symptoms mentioned above, it's crucial to consult a healthcare professional as soon as possible. Delaying medical care can worsen the infection, and in some cases, it can even become life-threatening. Early diagnosis and treatment can significantly improve the prognosis and reduce the risk of complications. In the next section, we'll discuss the various diagnostic tools used to identify pneumonia, which can help determine the most appropriate treatment plan. Now that we've covered the signs and symptoms of pneumonia, let's discuss the various diagnostic tools used to identify this condition. When you visit a healthcare professional, with symptoms suggestive of pneumonia, they will use a combination of tests and examinations to confirm the diagnosis and determine the best course of treatment. Some of the key diagnostic tools include when making new keys before main relating tools. These are the difficult. They don't need to consider to diagnosis. Physical examination. The doctor will begin by asking about your symptoms and medical history. They will then listen to your lungs using a stethoscope to check for abnormal sounds, such as crackling or wheezing, which may indicate pneumonia. 2. Chest X-ray.
This imaging test is often used to confirm the presence of pneumonia.
It can reveal the location and extent of the infection within the lungs. However, it's important to note that chest X-rays may not always detect pneumonia in its early stages, or in some cases where the infection is mild. 3. Blood tests. Blood tests can provide valuable information about your overall health and help determine if an infection is present. They can also help identify the type of organism causing the pneumonia, which can guide the choice of treatment. 4. Sputum culture. A sputum culture involves analyzing a sample of your mucus to identify the specific bacteria, virus, or fungus causing the infection. This test can be particularly helpful in guiding the selection of the most effective antibiotic or antiviral medication. These diagnostic tools play a crucial role in determining the appropriate treatment plan for pneumonia. In the next section, we'll explore the range of treatment options available, from medications to supportive care measures that can help manage symptoms and complications. Now let's delve into the various treatment options available for pneumonia. The primary objective of treatment is to combat the infection and manage symptoms, which can help prevent complications and speed up recovery. Keep in mind that the specific treatment plan will depend on factors such as the cause of pneumonia, the severity of the infection, and the patient's overall health. Some of the most common treatment options include 1. Antibiotics.
For bacterial pneumonia, antibiotics are the mainstay of treatment.
The choice of antibiotic depends on the specific bacteria causing the infection, and sometimes a combination of antibiotics may be prescribed. It's crucial to take the full course of antibiotics as prescribed, even if you start to feel better, to ensure the infection is fully eradicated. 2. Antiviral medications. In cases of viral pneumonia, antiviral medications may be prescribed to help fight the infection. However, not all viral infections can be treated with antivirals, so the treatment may focus on managing symptoms and providing supportive care. Supplemental oxygen. For patients experiencing difficulty breathing or low oxygen levels due to pneumonia, supplemental oxygen may be provided through a nasal cannula or a face mask. In more severe cases, mechanical ventilation may be necessary to help the patient breathe. 4. Fluid therapy. As pneumonia can sometimes lead to dehydration, it's important to stay hydrated by drinking plenty of fluids. In some cases, intravenous fluids may be administered to help maintain proper hydration and electrolyte balance. 5. Supportive care measures. These measures aim to alleviate symptoms and improve comfort during the recovery process. They may include over-the-counter pain relievers and fever reducers, cough suppressants, and rest to help the body recover. In addition to these treatment options, it's essential to follow your healthcare professional's advice and attend any necessary follow-up appointments to ensure that the infection is resolving and to monitor your recovery progress. In the final section, we'll discuss some preventive measures that can help reduce the risk of developing pneumonia, such as vaccination, good hygiene practices, and maintaining a healthy lifestyle. Finally, let's discuss some preventive measures that can help reduce the risk of developing pneumonia. Prevention is crucial, as it not only protects you from the infection, but also helps control the spread of pneumonia, causing organisms within communities. Here are some key preventive measures to consider. 1. Vaccination. Vaccines are available to protect against some of the most common causes of bacterial and viral pneumonia, such as Streptococcus pneumonia, Haemophilus influenza type B, and the influenza virus. Vaccination is particularly important for young children, older adults, and people with weakened immune systems or chronic health conditions. 2. Practicing good hygiene. Washing your hands regularly with soap and water, or using hand sanitizers when hand washing is not possible, is essential to prevent the spread of infections. Also, remember to cover your mouth and nose when coughing or sneezing and dispose of tissues properly. 3. Maintaining a healthy lifestyle. A strong immune system can help protect you from pneumonia and other infections. Boost your immune system by eating a balanced diet, getting regular exercise, staying hydrated, and getting enough sleep. 4. Avoiding exposure to respiratory infections and irritants. Limit close contact with individuals who have respiratory infections, such as the flu or colds. If you're in high-risk environments, consider wearing a mask to protect yourself from inhalant irritants or harmful particles that can damage your lungs. 5. Quitting smoking and avoiding secondhand smoke. As mentioned earlier, smoking damages the lungs and increases the risk of pneumonia. Quitting smoking and avoiding secondhand smoke can significantly improve your lung health and reduce your risk of pneumonia. By taking these preventive measures, you can lower your risk of developing pneumonia and maintain better overall health. Remember, prevention is key to keeping yourself and others safe from this potentially deadly infection.